Madam, shall I start?
Yes, sir.
Okay. Good evening to all. I welcome all of you for the webinar series on sheep and goats. Topic of today's webinar is tick-borne disease in sheep and goats. Speaker Dr. Mamta Singh. I welcome today's special guest Dr. Shilpasri Vasantrao Shinde and today's speaker Dr. Mamta Singh. I welcome both of you, madam. I welcome all the four permanent invitees, Dr. Umesh Chandra Sharma, President Veterinary Council of India, and Dr. Arun Kumar Tomar, President CSWRA and ISHGPU, Dr. Chanda Nimbukar, Director Animal Husband Division NARI, Dr. GV Ramanjanailu, Executive Director Center for Sustainable Agriculture. Respected participants, the main aim of organizing these webinars is promoting zero grazing of sheep and goats. The objective is capacity building of field veterinarians by dissemination and exchange of knowledge. So for this, we are conducting webinars every week, every Sunday at 5 p.m. Today's webinar is the 89th webinar. We started conducting this type of webinar since April 2021. We are maintaining WhatsApp groups also for daily updates. There are more than 6,000 plus veterinarians in all these WhatsApp groups. They are representing almost all the states and union territories also. And we have one YouTube channel with the same name, that is Sathyazerograzing, and it is open for all. There are more than 225 videos. All the recordings of previous webinars also available in this YouTube channel. We are associated with ISHGPU, that is Indian Society for Sheep and Goat Production and Utilization, Nimbukar Agriculture Research Institute, and Center for Sustainable Agriculture, and Karnataka Veterinary Association. All these webinars have been promoted by IVA Lady Wing Jharkhand, Blue Cross Welfare Foundation, Pashudhan Prahari, Laikwets of Odisha, and Omega Laboratories of Maharashtra. Our knowledge partner is NIPA, New India Publishing Agency of New Delhi. Now I will introduce today's speaker, Madam Dr. Mamta Singh. She is working as Assistant Professor in Department of Veterinary Medicine at College of Veterinary Science and Animal Husbandry in the University of Nanaji Deshmukh Veterinary Science University, which is located at Jabalpur. In 2011, she has completed her BVS and AH from College of Veterinary Science and Animal Husbandry, MP. And in 2013, she did her MVSc from IVRA UP in the field of calf diarrhea. And in 2020, she completed her PhD from IVRA in the field of bovine mastitis. She has around 7 years of experience, and there are more than 21 research publications at her credit, and 9 are published in international journals and 12 are in national journals. And she has participated in various training programs also. Here is a list of awards received by her. ICR JRS 27th rank by ICR New Delhi in 2011 for post-graduation in veterinary medicine. Institutional scholarship by ICR IVR Aizat Nagar Bareilly in 2013 for PhD. And she has received 2 awards for best paper presentation. This is in brief about today's speaker, madam. Now I request today's special guest, Dr. Shilpasri Vasantrao Shinde, Assistant Professor, Department of Veterinary Public Health and Epidemiology, Nagpur Veterinary College, Nagpur. I request you, madam, to kindly address our participants.
Thank you, sir. Good evening, everybody. Thank you very much for giving me this opportunity. I should say thanks to the organizers. Whatever I got about the Sathyazerograzing, I think they are working very nicely and they are giving the promising results for the budding entrepreneurs as well as towards the field veterinarians. Whenever we will see the Sathyazerograzing programs and all that things, and specifically the webinars what I attended for last from few months, I can say the topics and the information whatever they are giving, they are really whatever the speakers or the what we can say the candidates they are inviting for the talk or for the webinars, they are excellent. They are delivering very nice information, and through the different webinars they are really doing excellent. And accordingly updating the knowledge of the field veterinarians and the entrepreneurs also, because that is the basic need, what we can say, upgradation of the knowledge day by day, what is going on in the field. Afterwards, the important, if suppose we will say about the different topics, as sir just now told about that means this is the 89th webinar what they are regularly conducting. Topics are excellent, and today's topic, that is the most important one, I will say, as according to my whatever the knowledge it is, because most of the time what is observed, that is the tick-borne diseases in sheep and goat, it remains unnoticed for few initial days, and afterwards what happens specifically, if suppose we will talk about our country, that is anaplasmosis, babesia, then theileria, Q fever, these are some few diseases which is having more importance as such. But because of the farmers, or we can say because of they are not getting proper treatment on time to time, because of that these tick-borne diseases are to be unnoticed and unobserved in the country, and they are playing very much important role. And because of that there should, or we can say that there is a need of the spatio-temporal distribution of these diseases, then genetic diversity about the causative agent for that different diseases, because specifically they are these all are the tick-borne. And on the basis of this study, that means of course it should be done in the different type of the universities whatever it is available, and the knowledge which they are getting from the different researchers, it should be given to the field workers or the common people or the entrepreneurs, so that they can control the diseases, whatever ways, management systems, it's to be there, that is to be explained very nicely, because these diseases of small ruminants are showing maximum economic losses in the field. And because of this economic loss to the farmers, most of the time it remains what we can say, sometimes it happens that no sir, now it is not possible to sustain me, so I should go for the selling of all the batches, it happens. So to control all these things and to promote the farmers, it is required. And I think whatever the today's topic it is, it will give you the good address and highlight the whatever the requirements that it is to be there, and preventive control measures specifically for the tick-borne diseases. Thank you. Thank you very much, sir.
Thank you, madam. Thank you very much for accepting the invitation and also for participating. As you said, these diseases are unnoticed, madam. It is not that they are not there. They are there. They are there in the field, but many a times it is unnoticed, madam. Thank you, madam. Thank you once again. Now I request today's speaker, madam, Dr. Mamta Singh, to share her presentation. Dr. Mamta, madam, over to you.
Thank you, sir. Thank you so much for giving me an opportunity. So first of all, good evening to respected sir and my dear mom and all the participants. Today we here discuss the tick-borne diseases and sheep and goat. As we all know that small ruminant constitute a major component of economic, environmental and agriculture niche in various regions of the world, and they are the important source of the food, soil productivity and household stability. Sir, my voice is audible now?
Yes, madam. Yes, please continue.
As we know, tick and tick-borne diseases are the major constituent to the health and production of the large and small ruminants. And if we estimated the loss due to the tick-borne diseases, in India, it caused around the 498.7 million per annum in dollar. And in the world, its rough estimation is the 7,000 million. Tick can transmit various diseases like some viral diseases, bacterial diseases, protozoal diseases, and zoonotic important diseases. Here we discuss some important diseases that play important role in the small ruminants, that are the rickettsia disease, that is the plasmosis, anaplasmosis, babesiosis, theileriosis. I just informed to all participants, trypanosomosis is a protozoa disease, but it is not transmitted by the ticks. It is transmitted by the fleas. So here we not discuss the trypanosomosis, we just discuss the anaplasmosis, babesiosis, and theileriosis. As I told, three main tick-borne diseases, theileriosis, anaplasmosis, and babesiosis, are reported in the small ruminants, and they are responsible to economic losses in the many countries, tropical and subtropical country, including the India. And their high prevalence of these diseases, it is maybe because due to the environmental and climatic factor that make the favorable condition for the ticks and their life. In small ruminants, these diseases are underestimated because of its subclinical picture and natural resistance, especially in the endemic country where the disease is regularly occur, so that these tick-borne diseases are underestimated. And let's explore. First and all, we discuss the babesiosis. Babesiosis is the protozoal disease, and it is caused by the Babesia parasite that belong to genus Babesia and phylum Epicomplexa. It is the obligate intra-erythrocytic parasite, and mainly infect the small ruminants in tropical and subtropical country. The first observation of the ovine babesiosis was recorded in the Mysore, and it is designated as the Babesia motasi by the Achar and Shrikanta in 1934. In India, there are 4 species of the Babesia is reported in the sheep and goat. That is the Babesia motasi, Babesia bovis, Babesia foliate, and Babesia taylori. Among these species, only the 2, that is Babesia motasi and Babesia ovis, are the important parasites that cause the disease in the sheep and goat. Babesia motasi is more pathogenic as compared to the Babesia ovis, but Babesia ovis has a worldwide distribution. Well, Babesia motasi has limited distribution, especially in the Europe, Central and North Africa, Asia, and Central America. Nowadays, Babesia ovis are considered as emerging diseases. Emerging disease, especially in the Karnataka and surrounding state. And it causes high mortality rate, about the 30 to 50% in susceptible sheep. It is transmitted by the ticks of the genera Rhipicephalus, Haemaphysalis, Hyaloma, and Dermacentor. These ticks are mainly the 2 host or 3 host tick. And in the ticks, it is transmitted to the transovarian and by the transstadial route. Mechanical transmission either by the insect, either by the surgical procedure have no practical significance. So it is mainly transmitted by the ticks. This is the life cycle of the Babesia. Life cycle of the Babesia motasi or Babesia ovis almost similar to the Babesia bizimina. The infected tick during the ingestion of the meal transmit the sporozoite. Sporozoite present in the that is the saliva of the tick, and these sporozoite enter the host body and infect the erythrocyte. In erythrocyte, it go the multiplication by the binary fusion, and they develop the merozoite and some pregametocyte in the erythrocyte. These merozoite infected release from the RBC erythrocyte and infect the new RBCs. And these merozoite infected erythrocyte called the pyroplasm. These merozoite infected RBC is the infective stage for the ticks, and during the ingestion or taking the blood meal, these tick infected with the merozoite, and after the ingestion, the multiplication of these parasite occur in the midgut, and here there the sexual development occur. In the ticks, This parasite either transmitted to the transovary means that is in the next generation. The tree transmit the infection to the next generation or either in the next stage. Means adult can transmit the infection to the nymph or nymph can transmit to the adult. So these are the transstadial transmission. Infected larva, they mold and become the adult, and in after the that is for it after the replication, parasite reach the salivary gland, and in salivary gland again sporogamy occur and sporozoite are released. These are the sporozoite are the infective stage for the vertebrate. This is the life cycle of the Babesia. The clinical symptom of the Babesia ovis infected animal, they are the mainly the anemia, fever, that is high rise of temperature up to the 104, icterus, and hemoglobinuria. Hemoglobinuria is the most common finding during the Babesia ovis infection or Babesia mortacea infection. Severe anemia reported in the lambs that have low parasitemia, and erythrophagocyte of the both parasitized and unparasitized erythrocyte. It is the responsible for the reduction of the RBC count. Other symptoms include the development of the severe leukopenia, and young animal seem to develop less clinical symptom as compared to the adult one because of the innate immunity. It is also called the inverse age resistance. Means young animal develop less clinical symptom and adults develop severe clinical symptom. Those animals recover from the acute infection. They become pre-immune or they contain low level of the infection that become the carrier. Relapse is also common during the stressful condition like the food scarcity, adverse climatic condition, on another concurrent disease. These are the factors that are responsible for the relapse of the disease. This is the photographic presentation of the that is the Babesia infected goat. That the first one is the ecteric oral mucous membrane, and this is so the ecteric sclera and conjunctival mucous membrane during the that is the that animal infected by the babesiosis. Babesia mortacea that cause the disease either in acute form and acute form and chronic form. The acute form of the disease is characterized by the anorexia, fever, tachycardia, pale mucous membrane, jaundice, and hemoglobinuria. But in chronic form, there is the no characteristic symptom, and it is rarely responsible for the significant mortality. Other features include the abdominal pain, diarrhea, prostration, that means the extreme weakness, and death. Death usually occur after the that is the 48 hours after the onset of the clinical symptom. During the postmortem examination, we found that the enlarged and yellow liver, distended gallbladder that contain the thick dark bile, and bladder mucosa is edematous and yellow. The urine bladder contains thin watery blood and red urine. Spleen are enlarged and edematous and hemorrhagic lymph node. These are the PM findings of the babesiosis in sheep and goat. Now come in the diagnosis. Diagnosis mainly based on the physical examination and history. The physical examination and history gives some important indication for the tentative diagnosis. And the most common, cheap, and easy method is the direct examination of the blood smear. It is the gold standard method for the diagnosis of the babesiosis or thylaroidosis, with a sensitivity ranging of the 10 to the power 5 to 10 to the power 6. We confirm the disease by the PCR or serological testing like the complement fixation, indirect immunofluorescent antibody testing, and ELISA. There's a slide show the morphological description of the Babesia species in sheep and goat. Babesia motasi is the large in size, and it is usually pyriform singly or in a pair. And generally, it present in the RBC at acute angle. And Babesia bovis is the small in size, and it is mostly oval and piriform, and it is usually present at the obtuse angle. Both are the angle is the different. One is the acute angle, that is the Babesia motasi, and Babesia obtuse. Here I want to tell you differentiation of the both species is very difficult on the basis of the microscopic examination. It needs some expertization. For the confirmatory diagnosis, we go for the PCR. This is the photograph that's showing the infection, Babesia infection in the RBC. That indicate that the Babesia ovis, and that is the blue arrow indicate the neutrophil that contain the unsegmented nucleus. Babesiosis generally mainly present in the paired form, and Theileria is always present, generally present in the single form. Now come in the treatment. The drug of choice or most preferred drug is the diamagine aceturate at the dose rate of the 3.5 milligram per kg body weight on the 2 successive days through the IM. Or we can use single injection, single dose according to the some clinician and some report. They use the single injection at a dose rate of the 12 milligram per kg body weight. Imidacloprid diapropionate also use at the dose rate of the 1.2 milligram per kg body weight as single injection through subcut route. But some of the European country, that is the bane for the imidacloprid diapropionate because it has some carcinogenic effect. Previously, trypan blue is used for the treatment of the babesiosis, and with the dose rate of the 10 to 25 ml of 1% solution in the normal saline through IV. But it is not effective against the Babesia ovis infection. And one is the side effect of this trypan blue. It causes the blue discoloration of the mucous membrane. So the diamagine aceturate is the one most drug of the choice that used for the treatment of the babesiosis. Supportive treatment include the anti-inflammatory drug, antipyretic drug, hematinic preparation, and fluid therapy. Whenever you use the crystalloid drug, crystalloid fluid, take a precaution the rate of the fluid is not high speed and it accurate dose rate. In some severely affected animal, we give the blood transfusion and anti-shock preparation. Now, theileriosis, it is caused by the parasitic protozoan parasite, and it belongs to genus Theileria. Theileria species in a small ruminant are the wide spread, particularly in the tropical and subtropical region of the Africa, Middle East, Eastern Europe, Southern Europe, and Asia. There are the 6 species, well-known species of the Theileria. The first one is Theileria lastrocardi, Theileria lorenzi, Theileria eulenbergi, and Theileria ovis, Theileria separata, and Theileria reconditidae. In these, only 3 species are the pathogenic, that is the Theileria lastrocardi, Theileria lorenzi, and Theileria eulenbergi. In India, in our country, lastrocardi and Theileria lastrocardi and Theileria bovis are the more prevalent species in the sheep and goat. And that is the Theileria lastrocardi cause the malignant theilerosis in bovine and in sheep and goat, and Theileria ovis cause the benign ovine theileriosis. It is transmitted by the tick. Theileria lastrocardi is transmitted by the Rhipicephalus and Hyloma tick, and Theileria ovis is transmitted by the Haemaphysalis and Rhipicephalus ticks. Transplant-central transmission has been documented, but transovarian transmission is not documented in theileriosis. This is the life cycle of the Theileria species, and it is similar to the bovine Thalaria species. Sporozoid almost similar to the that is Babesia, but here is the sporozoid in the salivary gland of the infected haloma tick. Tick present in the tick saliva, and they infect the vertebrate host, that the bovine, either sheep and goat. These sporozoin infect the lymphocytes, okay, and in lymphocyte they release the cyzone. These cyzone multiply and multiply in the merozoite. These merozoite infect the erythrocyte, and these erythrocyte, that is infected erythrocyte, ingested by the ticks are nymph feeding. After the ingestion of these merozoite, that merozoite infected RBC, that parasite come in the mid gut of the ticks, and there is the sexual reproduction occur. And after the sexual reproduction, it again come into the salivary gland, and salivary gland there is sporogamy occur, and they release the sporozoid. Malignant thalarosis, that is caused by the Thalaria lustocardi. It is also known as the Thalaria hirsi. That is, the hirsi is the old name, but it is the present time it is known as the Thalaria lustocardi. It is reported in the North Africa, that India, China, and approximately that have the same geographic graphic regions, that are the tropical and subtropical country. Disease can be acute, subacute, and chronic. It depends on the that is resistance level of the animals, and it is a seasonal, that is depending on the availability of the ticks. All protozoal diseases that is transmitted by the ticks mainly occur in the summer season, and when the humidity is the high. Clinical sign in the acute form is the fever, cessation of the rumination, that called the atonia of the rumen, listlessness, nasal discharge, lacrimation, swelling of the superficial lymph node, diarrhea, and jaundice. In the chronic form, it is characterized by the intermittent fever, inappetence, anemia, jaundice, and emaciation. Anemia is always severe, progressive, and hemolytic, and it is associated with the oxidative damage. Mild infection reported in the young lambs and kids, with mortality mortality rate in the small ruminant infected with the lustocardi. They can approach 100%, and mortality rate is the 46 to 100%. Clinical cases are the more severe in the sheep than the goat. Recovered animal become prehuman, and there is no cross immunity between Thalaria lustocardi and Thalaria that ovis. Benign thalariosis, it is caused by the Thalaria ovis, and this species is almost non-pathogenic. And the clinical finding on this thalariosis, benign thalariosis, is the fever, swelling of the lymph node, is particularly in the region where the tick is attached, along with the slight anemia. Thalaria annulata also reported in the sheep and goat, but it not cause any significant illness in these animals. And that is the first report of the Thalaria lubensii, reported in the Karnataka state during the year 2015 to 2016 and 2016 to 2017. In 2020, Thalaria lubensii also reported by the Maharashtra. PM finding in thalariosis, it is almost similar to the bovine thalariosis, like the edematous swelling of the lung, yellow-brown liver that increase in the size, enlarged lymph node and spleen, petechial hemorrhage of the mucosa of the abomazum, and red patches on the intestinal mucosa, particularly in the cecum and colon. Kidney infection. Diagnosis on the basis of physical examination and history, and microscopic examination of the blood smear is either erythrocytic form, either coach blue body. Coach blue body constitute the it is the small body that present in the lymphocyte of the lymph nodes and spleen. Okay, it is 1 to 18 small reddish purple body that present in the lymphocytes. Erythrocyte form. It is the morphological description of the Theileria species. Both species very difficult to differentiate. Both are the same in size, and they are the round, oval, and rod shaped. This picture shows the mixed infection of the Theileria babesia. This is the Theileria, the single dot-like organism showing, and babesia is present in the pair form. Coach blue body is the lymphocyte that contain that is small reddish. Another test is the serological indirect fluorescent antibody test, ELISA. Molecular method include the PCR. PCR used for the confirmatory diagnosis, and we can identify the species of the Theileria in carrier in clinical cases. Therapeutic management, there is no specific treatment for the theileriosis in the sheep goat, but buparvacone is the most effective drug at the dose rate of the 2.5 milligram per kg body weight, and it given administered IM. 2 doses is sufficient at 48 hours apart. Halofuginol lactate also used at the dose rate of 1.2 milligram per kg orally. Tetracycline we use for the treatment of the theileriosis, but it is the less effective as compared to the buparvacone, and it is given with the dose rate of the 20 milligram per kg body weight, IV with normal saline for the 3 days daily. It is never given with the ringal lactate because it makes it chelate with the calcium and cause the adverse effect. The vaccine for the Theileria and babesia is just not commercially available in our country. Anaplasmosis, it is a tick-borne obligatory inter-erythrocyte bacterium of the sheep and goat and wild ruminants. Anaplasmosis constitute a burden to livestock health and production in the tropical and subtropical region, including the India. It caused great economic losses due to the decreased production, mortality, lowered work efficiency of the affected animal. There is the 6 recognized anaplasma species: Anaplasma ovis, Anaplasma marginale, Anaplasma centrale, Anaplasma platus, Anaplasma bovis, and Anaplasma phagocytosa. Among them, only the Anaplasma ovis that found is the most pathogenic, and Anaplasma marginale is the clinical form in the small animals. The Anaplasma ovis primarily infect the sheep and goat and cause the bovine anaplasmosis respectively. It is transmitted by the tick, either by Rhipicephalus, Haemophysalis, and Hyloma species. In addition, it is also transmitted by the heterogenic and mechanical transmission present by the insect. This is the life cycle. Almost is the single life cycle. Here, the mechanical transmission occur in the vertebrates, and the sexual development occur in the dermocenter rhipicephalus in the ticks. Salivary gland that contain the infective stage, initial body, it infective stage for the vertebrates, and during taking the blood meal, they infect the vertebrate host. The vertebrate host, it go for the asexual reproduction, and after the asexual reproduction, that is the infect the erythrocyte, and erythrocyte it is multiply and release the initial body. These initial body be taken by the tick during the ingestion of the blood, and in the gut of the tick they develop and multiply. Clinical sign of the anaplasmosis in sheep and goat, it is generally subclinical type. It causes the acute disease. An acute phase of disease is characterized by the fever, progressive anemia, icterus, weight loss, and sometimes the death. Anaplasmosis infection is more severe in goats than the sheep, particularly those animals are stressed and debilitated and weak. And goat they can remain mildly to moderate anemic after the acute disease stage. Some of the goats show the hyperexcitability and they may bite the innate object like the stone, plastic, wood, anything that is not eatable object. And anaplasma obese may predispose to the sheep and goat to other bacterial, viral, and parasitic infection. Diagnosis, it is the microscopic examination is and complementary ELISA. This is the gold standard method for the diagnosis of the anaplasmosis. Anaplasmosis is the dot-like organism that lie in the periphery of the RBC. The indirect immunofluorescent antibody test is widely used for the diagnosis of the blood protozoa and rickettsia. This is the anaplasma species that lie in the margin of the periphery of the that is erythrocyte. Treatment tetracycline, one of the best drugs for the for treating the anaplasmosis is the dose rate of 6 milligram per kg body weight for the daily for the 3 days. Long-acting tetracycline can be used at the dose rate of the 20 milligram per kg intramuscular as a single. Either we can IM, either we can IV. Imidacloprid dipropionate also used to treat the anaplasmosis at the dose rate of the 5 milligram per kg body weight IM twice and 7-day apart. Enrofloxacin is less effective as compared to the above drug, and it is, if required, it can be given at the dose rate of the 12 milligram per kg body weight, subcut twice for 48 hours apart. Blood transfusion are indicated in those animals in which PCB is less than the 50%. And during the treatment, rough handling must be avoided along with the supportive treatment. It is depend on the condition of the animal. It may include antipyretic, anti-inflammatory, hepatoprotectant, multivitamins, etc. Differential diagnosis of these diseases on the basis of the symptom. So fever present in the almost in all diseases in the Babesia, Theileria, Anaplasma, and Trypanosome. But swollen lymph node only present in the theileriosis. And nervous sign is the particular sign of the trypanosomosis. Nervous sign, you never find the nervous sign in the Babesia, Theileria, Anaplasma in the sheep and goat. Jaundice mainly present in the theileriosis, but occasionally present in the Babesia and Anaplasma. Nasal discharge is the typical sign of the theileriosis, and hemoglobinuria is the characteristic clinical sign of the Babesia. In the disease theileriosis, anaplasmosis, and trypanosomiasis. Now come in the tick management strategy. How to manage the tick management? By the use of the chemical acaricide like the cypermethrin, deltamethrin, that is ivermectin, permethrin. Then it is used for the control of the tick. Immunological means this is the under research, and in the some country vaccines are available that control the tick, like the tick guard, but in our country it is not commercially available. Some of the phytoacarists are also used for the control of the tick. Genetically, we focus the genetically resistance breed that are resistant to the tick infestation. In like the indigenous breed are the more compared to the crossbreed. And biological control agent also used for the control of the like the some of the fungi used for the control of the tick population. Here here we mention some ectoparasite drugs that use against the tick, deltamethrin, amitriptyline, and clozental. Cypermethrin and deltamethrin used as a spray or for the dipping. Amitraz also used for spray and dipping. But ivermectin we use as a oral or subcut. This is the here we discuss the life cycle of the three hosts. Because life cycle of the host is very important for the control and management of the tick. Almost that Fissiferous Hypodermocenter, this is the two or three hosting, and each is either larva stage, either nymph stage, either adult stage, present on the host body for the 3 to 5 day, and after the engorgement, taking full blood meal, they drop down. Either that is if larva is feeding the host, is engorged, and then after drop down, the larva molt in the nymph stage, and nymph stage again seek the new host or the same host for the feeding. After the feeding for the 3 to 4 days, they drop down and mold in the adult. Adult again that feed the new host, same host. This is the cycle. Each stage of the tick, take new host or same host for the feed. So during the management, during the control for tick management strategy, we first only for the on the animal's body, also for the that is the animal's shed, especially the cracks and services that present in the shed, because the one adult that takes lay 20,000 eggs, and these 20,000 eggs convert into the larva. So you also apply the that is the ectoparasite body of the animal along with the animal surrounding and services crackers. Tips on the using the ectoparasites are some tips here. We discussed the same use for the ectoparasites. Before that, using the dipping and spraying, animal must be sharing. Means you remove all the hair coat. And the second one is the use the lukewarm for diluting the medicine. Water fresh and always if always you use soft water, not hard water. And after that dilution, and that diluted use immediately. Not means you take for the long time. Use within the 60 minutes. It gives the better efficacy. Dipping is advised in the sheep and goat rather than the spraying. Is a more effective method. Dipping is as compared to spraying. And if required, mopping is to be done with the clean cotton cloth. Spraying around the recommended dose on the animal either 1% or so you for the surrounding the double concentrations 2%. And in the last it is
Madam, please unmute your microphone. Mamta madam. Speaker madam, please unmute your microphone.
Yes, sir. Yes, sir. Yes, sir.
Yes, we are not able to see your PPT also. Please start sharing again.
Just a minute, sir.
You were explaining about the Tikicide, using Tikicide, tips on using Tikicide.
Yes, sir. Yes, sir. This is a tip for using the parasites. First, before the dipping and spraying, most of the animal must be hair and wool. Always use lukewarm water for diluting the medicine. The water is not very cold and not very hot. Water should be potable, fresh, and clean. If possible, you use soft water. No, avoid the hard water. Dilute the solution just before the dipping and spraying. And after the dilution, use the solution within the 1 hour. It gives the better efficacy of the drug. Dipping is the best method for the as compared to the spraying. And if required, after dipping, use the that is a fresh cotton cloth for the mopping and spraying in and around.
Respected participants, I think she lost connectivity. So I think that should be her last slide. Mamta madam, your audio is disconnected. Mamta madam. Hello.
Yes, sir. Yes, sir. Yes, sir.
I think
Yes, sir.
you
I
have
think
to
some
conclude
network
it, madam.
issue.
But just to share your last slide.
So at the last, I just want to tell that only the treatment is not effective for the control of the tick-borne diseases. Along with the treatment, we must focus on the prevention of the transmission of the disease, for the transmission of disease. By the preventing reinfestation of tick, by controlling the tick from the cracks and services of the site. It is equally important for the of the tick and tick-borne disease. For this, we understand what is the life cycle of the ticks. So this is all about that is the presentation. I think it will be helpful to you all participants.
Madam, play your last slide.
Thank you, sir.
Madam, stop sharing. Mamta madam, stop sharing. Yes. Madam, hello.
Hello, sir.
Madam, see, one participant raised his hand. I will allow him to speak.
Yes, sir. Yes, sir.
Mr. Bistu Bas Matre, please ask your question.
Yes, sir.
Mr. Bistu Basu. Please ask your question. Mr. Bistubashu? Madam, stop sharing.
Okay, sir.
I think he has raised hand, but okay.
Okay, sir, no problem.
Madam, somebody is asking one question. Hello,
Yes,
Mamta
sir.
madam. What is
Ah,
the
yes,
reason?
sir,
Yes, Mr. Rangarao is asking, what is the reason for diarrhea in Babesia and Theileria?
Sir, that is maybe due to the weakness. Exact reason is I don't know, but in all cases, it not always present diarrhea. But in some cases, maybe it is due to the weakness and all. It is unable to digest proper food, and that is whatever nutrition we provide.
Okay. One question from Mr. Sanjay Kumar. Is there any vaccine useful for theileriosis in sheep?
No, sir, it is only for the cattle available in our Indian market. That is the Rakshavac tea. But for the this is not available for the sheep and goat.
Okay. But I think these are the only questions posted.
Okay, sir.
Madam, there are no questions. So on behalf of
Okay,
Sathyazerograzing, we express gratitude to today's speaker, Dr. Mamta Singh, and special guest, Dr. Shilpasri Vasantarao Shinde. We express gratitude to advisors of these webinars, Dr. Kiran Kumari, Professor Kavita Rai. Thanks to the knowledge partner, New India Publishing Agency of New Delhi. Thanks to the associates, promoters, and all the participants. Our next webinar is scheduled on Sunday, that is coming Sunday, 20th November. Topic is flukes and tapeworms, control and prevention. Speaker Dr. Manashwini Dehuri, Assistant Professor, Department of Veterinary Parasitology, Odisha University of Agriculture and Technology. Respected participants, if anyone of you is interested to deliver webinar lecture from this platform, just send me a message. It can be a short length video also. You can share your field experience, or it can be in your local language also. It need not be a regular webinar. Learning is a continuous process. From Sathyazerograzing webinar platform, you can listen to scientists, professors, and senior faculty working across India in ICR institutes and veterinary colleges. Do attend all the webinars and watch YouTube channel for previous webinar recordings. You can join WhatsApp group also for daily updates. If any one of you is not there in our WhatsApp groups, please contact me on my mobile number 8500404016. Just you can leave one message on WhatsApp. With this, we close this webinar. Thank you, speaker madam, and thank you, special guest madam. Thank you all the participants.
Thank you so much, sir.
Thank you, madam.
Thank you,
very
sir,
much.
giving me for this opportunity.
Thank you,
Thank you
madam.
so much, sir.